Welcome to the Darcy Wellness Show. During our series, we will present information on complementary and alternative medicine and how these can benefit you and your family, these non-drug, non-surgical options. Today we're going to talk about headaches. My name is Jeff Darcy. I'm an acupuncturist, herbalist, and director of the Darcy Wellness Clinic in Natick. And with me in the studio is Yuan Ling Liu, who is a registered dietitian, acupuncturist. We have Patrick Crowley, body worker, licensed massage therapist, and Dr. Couch, who is a chiropractor. So we're going to talk about headaches, and of course we know, this is an epidemic in our society, that so many people have headaches. The vast majority of them are tension-related headaches. So Yuan Ling, how many headaches are there in the U.S.?
There are 45 million people who are experiencing some sort of headache.
Right. And that's, we read this morning, it broke down as 25 million were men, 20 million were women. That's an awful lot of headaches. From your perspective, as an acupuncturist and herbalist, what do you think some of the major causes of the tension headaches are?
Well, as we are living in a fast-paced society and the stress of daily life and also just our, lifestyle in general are not supporting, a lot of stress, so create a lot of tensions.
We're stuck in fifth gear.
Right.
Most people have got 2 jobs, are working extremely hard.
Right. Lack of exercise, eating, healthy eating patterns. So all of those contribute to a lot of the headaches that you see.
Right. So, Patrick, as a massage therapist, I mean, you must see a lot of people with upper back, upper cervical spasms and tensions. So many people hold tension there in their everyday life. Many of them have headaches, I'm sure. In your experience with massage therapy, it's very helpful, right? The idea of getting a regular massage.
Yeah, almost. I would say the majority, maybe 90% of the people who come in to see me, whether they're coming in for another main complaint, they have an incredible amount of tension in their shoulders and their neck. So massage is very helpful for releasing the tension in the shoulders and neck through different techniques, trigger points, and different manipulative techniques.
And Peg, as a chiropractor, you see a lot of upper cervical problems, whiplash, all kinds of different problems contributing to tension headaches. How much of your practice, is headache related? I mean, how many people do you see?
Probably a solid 15-20% of the patients I see will come in for headaches.
And from your perspective, what are some of the causes of that?
Oftentimes there are fixations in the upper cervical spine due to
what's a fixation? Maybe you could.
Fixation is a vertebrae that essentially isn't moving quite right. Others may know it as a subluxation. It's essentially when that vertebrae isn't moving right, the muscles around that vertebrae are really contracted, which is preventing that vertebrae from moving in the first place.
Yeah.
If we're able to get into that vertebrae and do some manipulations to it through, again, a wide variety of techniques, we're able to loosen up that muscle and decrease a lot of those spasms and therefore those headaches.
So I've heard as an acupuncturist, we've heard the analogy of the tent pole. The ropes of the tent are the muscles, and the tent pole being the structure of the spine. And when the muscles get so tight, they torque over the tent pole. They pull the spine over and bring it out of alignment. So that impedes nerve flow, it impedes blood flow.
Right.
So presumably a lot of what you're doing, trying to get balance back into the spine, opens that up.
Oh, absolutely, yes.
So is that true for tension headaches as well as for, the vast majority of headaches are tension related, but there are of course, migraines that are especially, severe and agonizing. Have you been able to help migraines?
Absolutely. Migraines is definitely a separate entity from the tension or the cervicogenic type headaches. Migraine headaches have to do with aberrations in flow of blood to the brain, and that's pretty much established as the cause of migraines.
Right. So do you think Isaac Newton had cervical problems when the apple dropped on his head?
Yeah, probably did. Probably did.
So the idea that even if you have a head trauma or there's some You know, like if in some sport you take a knock on the head, or in soccer, you know, if you're heading a very high header, sometimes that will shift the cervical vertebra out of balance.
Sure. Well, what it'll do essentially is when you injure your neck, the muscles in the neck try to protect the spinal cord pretty much at all costs.
Yeah.
So it will spasm the muscles around the neck, and one of the really important muscles in the neck is called the rectus capitis posterior minor muscle.
Can you say that 3 times?
Rectus capitis posterior minor muscle. It's a muscle in the very top part of your neck, and it forms actually a dural bridge with the outside covering of the brain called the dura mater. And when there's tension on that rectus capitis posterior minor muscle,
You did say it 3 times.
it pulls on that dura mater, which is very pain sensitive and causes a majority of these cervicogenic or tension type headaches.
So basically, it's a pressure that's actually pulling on.
Exactly, it's pulling on the outside covering of that brain.
Right. And that's from trauma. Is that also from stress related?
It's from trauma, but absolutely from stress.
Yeah.
You know, it's really difficult to exactly say how or why that neck is in this particular way, but all we really know is that, you know, it is in that situation right now.
Right. So, Yuan Ling, this idea of, you know, stress and tension leading into headaches, most people will approach this with pharmaceuticals, right? They'll go to the drugstore, they'll Tylenol, Advil. You know, we know that 32,000 deaths every year are caused by non-steroidal anti-inflammatories due to kind of depleting the intestinal lining, causing bleed outs, causing all kinds of problems. Many people get stomach problems from pharmaceuticals. So yours is a non-drug approach, no side effects. You're using what, primarily acupuncture and herbal medicine in your practice to treat headaches?
Right. And one thing is that no matter what kind of condition you have, it's always a symptom of something else underneath that's you're not addressing. So just by taking a pain medication, it's only numbing the sensation, and it doesn't last. And believe it or not, this morning we had a migraine headache patient. When her migraine being triggered by stress, noisy environment, a certain food, or lack of sleep, fatigue in general, she has to take all of very high dose of pain medication, and she has to lie in a dark room.
Yeah.
And imagine having 2 kids and unable to, go out, help them out, and you have to
And
completely
oftentimes
seclude.
hormonally related. So
Right.
it's I've treated patients who 2 or 3 days of their life every single month is
Right.
completely carved away from them.
Right, and the long term, and she realized that the more pain medication she takes, it's just sort of helping her temporarily, and she has to up the dose and change different pain medication because it's also, as Jeff was saying, long term taking of all the pain medication that actually just damage your stomach linings and creating bleeding and also a lot of indigestion issue. And acupuncture is sort of using natural body. We have a mechanism in our body that we cope. When something, if there is a pain, that means there's something are not flowing smoothly. Chinese medicine talks about when there's lack of a smooth flow of energy in blood, that creates pain sensation. So the body is telling you there's something wrong. So what we address is that we address underneath what exactly is creating the stagnation. So acupuncture and herbal medicine, they're all natural substance that has less side effects, and our body tolerates things are in natural form much better than synthetic form.
So this idea of a natural flow of energy that gets interrupted in traditional Chinese medicine, the idea of energy coming up into the head. If we're thinking all day, if we're angry, there's this classic idea of being red-faced, or very strong emotions will send the energy up to the head. But a lot of the problem is it's not recirculating back down away from the head. So from a Chinese mechanism of looking at the perspective of looking at this is about pulling energy away from the head, getting it to circulate more efficiently. Would that be?
Definitely, and when there's a blockage, we all know when the blood is not flowing, it coagulates, and when the water is not flowing, things, the inner water become dead water. So we are promoting a better flow so that the body is balanced, and also relieving pain, achieve a more balanced flow in the body.
So this idea of the polarity of the energy being stuck in the head, some of the points that can you point to some of the points that can you massage some of the points that would
definitely.
be commonly used?
Yeah, definitely.
So you would use this point here.
Yes, very
that you
basic one. If you actually try on yourself, for people who are in a lot of stressful environment all the time, if you check your muscle right here, it's sore. If you you can periodically press this area. This is a big relief point, and also it's a trigger point around this area. So a lot of people have, one side of a headache or headaches on the side. That was definitely helpful. They're also on the foot, right next to your pinky toe. There's another point. Yeah. So there are different areas.
So there are points around the body, and actually this point here is a very famous point, just between the thumb and the forefinger, proven in many dental studies for frontal facial pain. So, Patrick, the idea in massage therapy then is that blood flow is being restricted into the head, and possibly the underlying structure of the muscles being tight are torquing out the cervical vertebra, that nerves are connected into the dura, as Dr. Couch was explaining for us. So in massage therapy, what are you looking to do? I mean, somebody comes in, they're very tight in those muscles through the neck, and you're looking to release some of those tension?
Yeah, sometimes the muscles are very bulky and tight, and sometimes they have this very kind of thin, strained feeling. And so in both cases, you're trying to get more blood flow into the muscles by different kinds of manipulations.
Right.
One of the amazing techniques for headaches is called cranial sacral therapy, which I also practice. And it involves working with the head, the bones of the head. And it's incredibly effective, for many different kinds of headaches. It's very interesting, the temple bone as we know it, and we rub our temples to cure headaches. There's this bone called the sphenoid bone that goes right through the skull here, comes to the surface only at the temple. It's about a roughly round area, two sides of the head. It also makes up the back of the eye socket. And so it makes a lot of sense that this bone, that some of the sensitive kind of wafer-like parts of this bone also cradle the underside of the front of the brain. And when you rub this bone, you're literally creating some movement in all the bones of the head and helping relieve tension and create some space.
So, Peg, with chiropractic, we know that antidepressants, nortriptyline, beta blockers, and calcium channel blockers, corticosteroids, they may provide short-term relief. What kinds of headaches respond best to chiropractic treatment, in your experience?
Well, as we were talking about before, the kinds that respond best are the tension type, cervicogenic type headaches, the headaches that come from the neck. Other ones that respond really well are jaw-related headaches. Many people don't know that people with TMJ dysfunctions, temporomandibular joint dysfunctions, have quite severe headaches. And if we're able to get into the jaw and manipulate some of the muscles, like the pterygoids, the internal, the external pterygoids.
So like TMJ actually sets you up for headaches?
Oh, absolutely, absolutely. You see that actually quite frequently.
Yeah.
And if we're able to get in there and work on some of the muscles there, do some gentle manipulations with the jaw, we actually do quite well with relieving many of those headaches.
Maybe we could go to our next slide. So this is a study that shows that acupuncture is an effective tension headache remedy. But the interesting thing about this, Yuan Ling, is it not only relieves the pain, but cuts the rate of reoccurrence almost by half. So it's really not a symptomatic approach. The idea of regular acupuncture will reduce the headaches themselves, but also cut by 50% the reoccurrence. So it's not just acupuncture and herbal medicine that you're dealing with. You're also shifting in lifestyle changes. If tension is the cause, then relaxation must be a way to unwind that. Do you approach that when somebody comes in and sits down?
Definitely. So as we mentioned before, there's always underlying problem. That's headache is just a symptom. So there are many things that cause that symptoms. As you were saying, the stressful tension headache. There are also other things as well. For example, there are other kind of headache. For example, dull, constant headache tend to be people who are deficient. They are either deficient in energy or blood that can lead from cause from aging.
So this is from a traditional Chinese viewpoint.
That's right.
Deficient in blood. It's not anemia.
Right.
Yeah.
So other symptoms that that go with the headache is that there are a lot of dizziness, fatigue, poor energy. So there are a lot of symptoms that are driven to one. Headache is not all the same. So we address the underneath
So you try
cause.
to find out, differentiate what underlying cause is from traditional Chinese medicine. But do you also recommend relaxation, for instance, to patients? I mean, if stress is the cause of a lot of the tension headaches?
Definitely. If we don't address that, they come for acupuncture. Once acupuncture is very relaxing, then their headache subsides. And then you go back to your regular life
That's right.
schedule.
Go back to the regular causes.
That's right. Your headache comes right back.
And maybe we could go to our next slide. This one is showing that acupuncture patients had 22 fewer days of headache per year compared to the usual care group. So they compared the group that got regular acupuncture to a regular group of headache sufferers, and that there was 15% less medication, 25% fewer doctor office visits. So these are very significant results, and is that because the acupuncture is effective for the pain, but you're also engaging in lifestyle, you're trying to take away dietary triggers? As a registered dietitian, part of your intake must be to cover any potential dietary trigger for the headache.
Right. So when we are interviewing, we're assessing the person as a whole. So we look into dietary and also other symptoms that associated with headache. For example, a lot of people, the headache food trigger tend to be, caffeine, alcohol, spicy things, and things that they tend to have allergic reaction to that triggers the headache.
How does it trigger the headache?
How
Is there an inflammatory process or something that shuts down blood flow or dilates blood vessels?
Actually, they constrict the blood vessels, so it's sort of the body natural response. And for example, a lot of people have hypertension, so if they are not careful eating a lot of salt, eating things that are spicy, things creating heat and creating volume, and they raise their blood pressure, then under stress, so everything triggers.
So that allows a lot of blood to go.
Right.
It's restricted. A lot of blood is restricted into the head.
Right. So their lack of smooth flow. So when the blood are not smooth flow, things will coagulate and leading to pain.
Yeah. If we could go to our next slide on herbal medicine. How does herbal medicine help? I mean, there's the classic. I mean, we all know that aspirin helps a headache. Well, aspirin came from salicylic acid that came from meadowsweet and willow bark that was commonly used in America for thousands of years before we arrived for pain and for headache. So in use of Chinese medicine has so many more tools, herbal tools available in the Chinese pharmacopoeia. So what are some of the herbs that you like for headaches?
The Chinese herb I know they're all in Chinese names, so I wouldn't be
like
on.
Viplurum is one of them, Chai Hu that you like.
Right. So what did
So these are compounds, anti-inflammatory compounds in nature, because of course plants need to control inflammation, need to control infection, so they will develop these compounds that
something
traditional
like,
medicines research and find.
Right. Something like aspirin has a little bit of blood thinning effect and also a little bit clearing heat. So some of our Chinese herb does a similar function. So for example, if somebody has hypertension and headache, something like that would be really helpful.
Yeah.
Help better circulation, clearing the heat, so promote better flow. So that will alleviate the headaches.
Right. Any poultices or plasters that can also help with tension?
Definitely, I mean, the key is that the relaxation aspect. The herbs that taking internally are more addressing the underlying problems. So there are topical herbs that we use, but the more potent is the one that you take by PO.
Yeah. If we could go to our next slide, and over to you, Patrick. So, there's, or actually, that's our chiropractic slide. There's Peg giving an adjustment to the lower back. Unfortunately, not. Do you often treat the lower back for headaches? Not commonly.
No.
It's mainly
Wrong picture.
No, low back. I mean, there is a kinematic chain throughout the whole entire body.
Yeah.
And, something affecting the foot will definitely affect the low back, which will affect the mid back, which will affect the upper back, and so forth and so on.
But mainly it's
generally,
cervicogenic, which maybe you could explain what cervicogenic.
Cervicogenic, the term literally means coming from the neck.
Yeah.
Cervical meaning the neck vertebrae, the cervical vertebrae, and genic meaning to come from.
Yeah.
So
the cause of the headache is in the structure of the neck.
Exactly.
Yeah. So how long does it take you to talk us through the chiropractic process for treatment of headaches? What would it look like? Somebody comes to see you.
Sure, we would do a full evaluation to make sure that there aren't any other major causes, any other causes of the headache that's present.
Some more dramatic causes that haven't been diagnosed by.
There are a lot of causes for headaches out there, from dehydration to blunt force trauma to the head, to bleeding in the head, to tumors in the head. And
so all of those have to be discounted.
Exactly. We have to rule out all those, and what we'll do is we'll do a pretty detailed evaluation to make sure that the cause is truly coming from the neck or a similar structure like the TMJ, and we would go ahead and adjust that area. And in addition to that, what I like to do is do quite a bit of myofascial release in that area to really get that muscle release, because as Patrick knows.
So explain what the myofascia is. Most people don't know.
Sure, the myofascia is the covering of the muscle. The fascia is the outside covering of the muscle.
Somebody explained it like when you're eating chicken and you're pulling it away from the bone. The myofascia is what's holding on.
Sure. Well, the myo is the muscle part, and the fascia is the outside covering of that muscle. And both are very pain sensitive. And when they become irritated, they can pull and cause tension on that muscle that we were talking about earlier, the rectus capitis posterior minor muscle, and can cause a lot of those cervicogenic headaches, the headaches that come from here to about right here.
Yeah. How's it causing them? And so basically you have the idea of the myofascia clamping down, getting irritated from being so tight.
Right.
That's restricted. That's clamping on nerves.
That's clamping on
torquing.
That's clamping on that
structure.
Really pulling on that outside covering, that dura mater that we were talking about, and that dura mater is extremely pain sensitive, as we mentioned before, and that in itself will definitely cause those headaches.
Yeah.
So
that if we could go to our next slide, that kind of leads into, the idea of, that 32% of adult Americans are, have received massage in the last 5 years. That's a dramatic figure, Patrick. Massage therapy for people with severe neck, back, shoulder pain in the 65 and older group tripled. So people are starting to realize, wait a minute, I've got a massive headache. Lots of Tylenol is not kind of working for me. I'm wearing my shoulders very high. I should see a massage therapist.
Right. I think, like Yuan Ling was saying, that people are realizing they need to take care of themselves with other means other than just drugs.
Yeah.
And so coming for a massage is really part of that. And in the kind of work I do at the Darcy Wellness Clinic, I also lead people through relaxation as I'm giving them a massage. So it's a skill to learn to relax. We have to learn how to do it.
Right.
And the techniques that we all use help somebody, but they also need to be taught. They need to be educated on different relaxation techniques.
Even just a simple progressive relaxation technique of starting at the head, sweeping the mind down through the body methodically over 20 minutes, relaxing as you go. Studies at the Deaconess Mind Body Institute showed that if you did that 20 minutes every day for a 5-week period, that would reduce tension headaches by 70%. So just the simple effect of moving the mind methodically
Right,
through the body,
scanning the body.
relaxing. And it's believed that it helps get hold of the relaxation response. That it takes 20 minutes a day for a 5-week period to get a hold of the relaxation response so that we're able to, at will, create a relaxation response in the body. And that must transfer through into the myofascia, into the dura, and help to keep the energetic polarity down. From whichever perspective we look at it, from chiropractic massage or acupuncture, it shifts the body's physiology away from this tension-related thing. So exercise can be a large part of that release of tension from those muscles. And as a body worker and a
yoga teacher as well.
teacher and dancer, famous dancer, maybe you could show us some of the techniques that you use for that.
All right, well, one is just a very simple exercise of just rolling the neck. And so it's there's a sense of length through the spine as you are rolling the neck. So you're actually thinking about your whole spine, and you're just going in these very fluid circles, very slow, and concentrating on breathing as you're doing it. So breath is also a very big factor in relaxing. The other thing you can do is a roll down of the spine, which gets into the spinal muscles, particularly in the upper spine and mid-spine, that can often have an effect on causing headaches. So you just simply let the weight of the head release, and you roll down vertebrae by vertebrae, breathing, and you're really letting the weight of the head stretch the muscles next to the spine. Same thing when you're coming up, and you're stacking the vertebrae from the bottom to the top. So this is really a very simple and wonderful exercise that can relieve headaches.
Good thing. Thanks, Patrick. So the idea of stress again, we have there's actually on our website there's a stress test that people can take that will score the amount of stress that they're in, and when they start to implement some changes in their life, they can then go back and rescore themselves, and it will score lower. So these kind of lifestyle shifts and changes are really an essential approach to get to the cause of tension-related headaches. So we have covered today the perspective of chiropractic and the structure of the spine, to releasing tension from the muscles, to the energetic polarity of acupuncture and herbal medicine. These are non-toxic, non-drug related therapies that are extremely useful for headaches without causing any side effects at all. So I'd like to thank everybody for staying with us and watching another in our series of complementary and alternative medicine from the Darcy Wellness Clinic. From myself, Jeff Darcy, acupuncturist and herbalist, director of the Darcy Wellness Clinic; Yuan Ling Liu, acupuncturist, herbalist, and registered dietitian; from Patrick, licensed massage therapist; and from Dr. Couch, a chiropractic doctor. We want to thank you very much for listening to our program, and we would like to wish you and your family all the very best for your health.